Niger is a developing, landlocked country located in western Africa. It is surrounded by the countries Algeria, Libya, Chad, Nigeria, Benin, Burkina Faso, and Mali. It was originally colonized by the French in 1899 and did not gain its independence until 1960. Niger is the lowest among all nations around the world in development with a development score of 0.354. With a growing population of 16 million due to a high birth rate, 45% of the country lives below the poverty line. The general health situation in the country is extremely poor, lacking adequate health care facilities and trained personnel. Our organization, the Niger Health Organization, strives to help resolve some of the ongoing health issues Niger is facing. The Niger Health Organization strives to restock local health facilities, better educate medical staff, and make vaccinations more accessible in rural areas of eastern Niger. The Niger Health Organization's vision is to provide vaccinations, supply health centers with medical items, and train medical staff so that 1 million people located in the rural areas of eastern Niger are able to receive proper care. According to Britannica, Niger lacks the proper funding and personnel in order to give proper health care to its citizens. This country is extremely susceptible to outbreaks in infectious diseases due to its poor ability to manage and control possible epidemics. Lack of healthcare resources, poor sanitation, shortage of healthcare staff, medical equipment, and basic medications leaves more than half the population of Niger without proper access to healthcare services. Lack of immunization is a grave issue that facilitates many epidemics in Niger. According to the World Health Organization, just this past July, an outbreak of cholera was detected. This, unfortunately, is not an uncommon occurrence. However, by increasing access to vaccinations at local clinics, we would be able to make routine immunizations possible by offering free, frequent bus rides to citizens during vaccination times. In conjunction with this service, we would also design a system in which trained professionals would deliver immunization services to those unable to travel. By implementing these interventions, we would be combating outbreaks of vaccine-preventable diseases that are ubiquitous in Niger. One possible risk for sustaining this vaccination plan is the outdated medical and administrative protocols that could lead to unsanitary vaccination practices as well as issues in patients' medical record upkeep. However, by upgrading both procedures and introducing more systematically sound approaches, we would be able to counteract these issues. A measurable indication of increased access to vaccinations would be the successful execution and maintenance of systematic vaccinations throughout rural areas of eastern Niger. In other words, vaccination coverage rates should significantly increase. Niger faces a lack of supplies to properly care for patients. Oftentimes, medical facilities are undersupplied with necessary healthcare supplies to carry out even the most basic physical exam. This leaves healthcare professionals without the proper tools to successfully cure patients. We will focus on supplying these healthcare facilities with proper antibiotics, medical equipment, as well as viral tests to identify diseases to eventually cure sick patients. With these medical techniques that are usually unavailable to rural areas in Niger, we will hopefully be able to decrease the spread of disease by being able to identify and hopefully cure patients with preventable diseases. One risk we may face in implementing is the lack of trained medical professionals being able to successfully use these supplies. It is a well-known issue that these medical centers are often not equipped with the most qualified medical personnel to support the needs of patients. It is a possibility that giving the facilities necessary medical supplies will not solve any issues if the medical staff is unsure how to use them. We will have to try to reduce this issue in our third initiative, educating medical staff. A measurable indication of supplying medical facilities is the overall decrease in preventable disease over a 5-year span. If medical professionals are using the equipment and prescribing the right antibiotics, we are supplying, a decrease in widespread epidemics of preventable disease should be seen. We are devoted to educating the medical staff in Niger so that they are better prepared to care for patients with the new medicine and technology we will supply. Due to brain drain, there are very few highly educated doctors, nurses, and general medical staff who are capable of managing sick patients until they are cured. According to Pacific Prime, Niger has one of the lowest doctor-to-patient ratios in the world. To tackle this severe issue, we have contacted doctors from the Jackson Memorial Hospital in Miami, Florida, who have agreed to take time off of work to train the medical staff across rural Niger. By sending over Western doctors, we can reduce the medical issue arising from insufficient funds. It is possible that we struggle to find doctors who are willing to take their time off from work to go to Niger on low pay. However, because we have already discussed this plan with Jackson Memorial Hospital, we feel confident that the doctors will volunteer. We will be able to measure the success of this initiative based on the doctor-to-patient ratio and the survival rate throughout rural Niger. As the doctors from Jackson Memorial Hospital go through with their medical training, Nigerian doctors and other prospective doctors will be inclined to take part in classes and therefore raise the number of doctors in Niger. The more educated the doctors are, the better they will be able to tend to patients and use the medical supplies correctly, ultimately saving more sick Nigerians. With the funding at our disposal, our work would be achievable in 5 years. Calculating the cost of completing our goals, it is very possible that we are able to reach and support 1 million people living in eastern Niger. Our implementation plan is to work with health centers in Niger to get an accurate picture of how to best send support. We will also work with Jackson Memorial Hospital to seek advice and personnel to work in Niger.